Hello, everyone. I'm Melinda Huffman, co-founder of the National Society of Health Coaches. Because evidence-based health coaching is so new, the Society will be periodically interviewing national thought leaders in the field and sharing this with you over time. Today, our focus is going to be on independent practice as a health coach. We get numerous calls about this almost on a daily basis, but for sure on a weekly basis. As a result, today we're very pleased to have with us Jackie Bryan of Rye, New Hampshire, who lives there with her husband and their children. She's been in independent practice for 13 successful years, well before health coaching ever became a national focus in healthcare. Jackie's nationally recognized registered nurse, whole health educator and advocate, and certified health coach. She has her master's in health communication from Tufts University School of Medicine. As a writer, author, and national speaker, she's been featured in the New England Cable News TV series on health coaching and has written for Weight Watchers International Ambassadors, and also conducts coach clinics nationwide on behalf of the National Society of Health Coaches. We'll provide Jackie's contact information and also that of the Society at the end of the interview. It will be on the last slide so that you'll be able to take notes about that. Jackie, thank you so much for being with us today. We sincerely appreciate your willingness to share your experiences in independent practice as a health coach, and we know that our listeners will have some very valuable takeaways to consider from our conversation together.
Oh, Melinda, thank you so much for having me. It is such an honor to be here. I'm just thrilled to be a part of this webinar, so thank you so much.
So let's just start out really, and this is something that I always think about too when someone shares with me that they've gone into business or that they've started something new. What was the catalyst that really started your personal career in independent practice as a health coach?
So in your introduction, you were discussing my background as a registered nurse, and my background really was in critical care, an ICU nurse. I had also worked for some medical companies as a consultant, and really always was incredibly comfortable working for organizations. Never considered myself someone that would branch off and start my own business. But that all changed back in 2003. I was diagnosed with a very aggressive form of breast cancer at the age of 37. And it was a huge game changer because in my effort to educate myself on disease prevention, I started to look around and realize that there may be a need for this type of coaching in the field of healthcare. Because what I found was that people were coming to me as I was digging around for information to find ways to help myself. Because, Melinda, one of the things that was shocking to me and many of my family members is I was a pretty healthy person. I was not someone I never smoked. I didn't really drink a lot. I was an exerciser. You know, I did all sorts of races and really took very good care of myself. So when I was diagnosed with breast cancer, it was just mind-blowing. So I started looking and digging and trying to understand, you know, what it was that potentially could have led to me getting sick. My cancer had spread to my lymph nodes, which is not great, as you know, as a nurse. I had 6 surgeries in a year. I had 8 rounds of chemo, 6 weeks of radiation, 7 years of hormonal therapy. My world was turned upside down, and in that process and through my own self-discovery, I decided, you know what, I want to keep people out of the hospital. I'd like to have the opportunity to share some of this knowledge with people and partner with people in a way that I can guide them towards health behavior change. So that really was the main catalyst, sort of the springboard that got me working as a health coach one-on-one with people and also writing all the programs that I do.
So really, at that time, as we know, health coaching was not really on the radar at all. But that was just something that you personally wanted to attest to through your experience, and what an experience that must have been with small children as well.
Yes,
And
yes.
other. So that had to have been not a real reach in terms of medicine and nursing, but in terms of coaching another. and how that must have inspired you to want to reach out is quite incredible to me.
Well, I think what people may not understand about health coaching is it is an incredible privilege to be able to partner with an individual who may be afraid, who may feel vulnerable, who might be in a position where they don't understand or are having difficulty navigating the medical world. It's such a privilege, a total honor to be there with these people. And I know firsthand how terrifying it can be to be dealt a life-threatening, diagnosis. And what's interesting is, in medicine, they give you this diagnosis, you're in this total fight or flight stress response, and then they want you to make some major decisions.
Right.
And
it's going to affect your entire life.
It is. It's not the time to be making major decisions when you're in this place. And so my job as a health coach, a whole health educator, is to really sit back and listen and understand, seek to understand what this person's feeling, have that empathy and understanding to try to partner with them and move them towards some behavior change, because I was desperate. I remember being with my family at an outdoor play, and I was laying on the ground sobbing. I was 37 years old, and I was just saying, sort of looking up at the sky and saying, I just want another chance. Somebody give me one more chance so that I don't have to go through this. This was my thought. And again, it turned out to be a catalyst that moved me towards one of the most rewarding careers I could ever imagine.
Just amazing. What were the most important steps you believe were the key in launching your independent practice?
Well, that's such a good question. I think back then, really things started to take off for me in 2005. I identified the need in the community. So I figured out, okay, now there's a need, but now what do I do? I had all this great knowledge as a medical professional. I grew up in this family of medical professionals. My grandfather was a surgeon in Boston. My mom was a nurse. My grandmother was in the medical field. So we all, I had this background, but I really didn't know how to partner with somebody to facilitate behavior changes. And this is really when I started seeking out organizations that could help me become a better practitioner, to partner with people to move them towards change. And that's how I found you, Melinda, the National Society of Health Coaches. And it was very important to me to choose an organization that certified medical professionals. There's a lot of different options out there today for health coaching. In fact, if you Google health coaching, you'll be very overwhelmed by some of the hits that you get. So for me, the National Society of Health Coaching set the bar pretty high for medical professionals to be certified as health coaches. So that was one of the first things that I did, was to get certified. And after I became certified, and I practiced on my friends and family, had a lot of practicing. I decided, well, you got to practice, and you have to make mistakes. That's when I coach people building their businesses, that's one of the things I do. I'm like, mistakes are good. Use the mistakes, learn from them.
Absolutely.
I made the decision to form a PLLC because, which is a limited liability company, and I was really practicing as just an independent practitioner under the scope of my nursing license for the state of New Hampshire. And when I started to grow, and I really grew quite quickly, partially because there wasn't really a lot of people out there doing what I was doing, I did form the PLLC, which I wanted added protection for myself. And not that I'm prescribing medication or, doing anything too crazy, but I did want to have some protection. So I did get insurance and an attorney. My friends and family will share with you that I am definitely somebody that glazes over with a lot of paperwork. If you hand me, you can put me in front of an audience of 300 people and I'm fine. But if you put a big stack of papers on my desk with all these Post-it notes, I need a paper bag to breathe into, because I get very anxious with paperwork. It's not something I feel comfortable with. So I had found as many people that could support me with some of the paperwork, like filing the state reports and doing some of the financial stuff. So I do have an attorney and accountant. I went out and got a website, and really my website was very basic when I first started. You just go to the page and there's a big picture of me and this is what I do. And then over time that website has grown, and so when I work with people, I'm always like, just get a website presence, and then you can build that as you grow. Social media. So back then, it's making me sound really old, but back then, back in 2005, we didn't really have a lot of social media, or at least I wasn't very active. In fact, I got on Facebook because my oldest child got on Facebook, and I was like, I better get on Facebook and see what she's doing. Right. So, my social media presence grew, and that, I think is a really important part of anybody's practice, just because social media is a huge part of everything that we do today. And you'll see that many age groups are on it. It's not just the millennials or the Generation Xers, but now we have baby boomers and even the silent generation that's on the web as well. And I think probably the most important step, and this one probably should have been first, would be my passion for helping others. My medical background and becoming a certified health coach and learning the skills necessary to facilitate behavior change, those are so critical and so important. But if you don't wake up every day with this desire and this passion to help people and feel like it's almost like your calling, sometimes I think I might not be much fun at a party. I might be, but I can always see if I get into something, all of a sudden people's eyes glaze over and I'm like, oops, went a little too far. But I'll tell you that passion for what you do is critical in definitely one of the most important steps you can have in launching your practice.
What I've another key point I think that I've picked up from you and what you were saying is that, and I found this also in the case with the society when it was co-founded, was to look at your strengths, and for you, that passion and the experience that you brought to the table and your genuine feeling for others and being able and comfortable to get up in front of people and share were key in those talents that you were blessed with to really just hone in on those and launch from those. For others, it might be something different. For me, it was presenting and writing. And so those, no matter who you are, depending on what your goal is, especially in health coaching practice, is to look at what you have that you can build upon. And like you were saying, you may not have used social media in the beginning very much. Not many people were 10 years ago or 13 years ago, but now it's very different. And I think what you said about growing is something that every single person in practice will do, and in life, is to grow built upon those things that you bring to the table. So very, very, very important, very interesting.
Exactly.
What level of importance do you think a business plan plays in startups? We have so many people that call saying, can you give me a business plan? Can you provide a format for a business plan? Well, there's plenty of those online for free. Plenty of people that want to share. Really, I guess what's not available today online in some cases in terms of format, forms, formats, and so forth. But what kind of importance do you really think a business plan plays?
Well, I guess I need to be a little honest here. My definition of a business plan 13 years ago was sitting across the table from my husband and saying, "Hey, what do you think of this idea?" And he said, "Oh, that sounds like a good one." And that was the business plan. So I think I will share with you, that was the birth of the idea, basically. But the business plan definitely came into play when I identified this as a real business. When I first started out and I was working one-on-one with clients, my husband would jokingly say, "Oh, it's your facial fund, honey." If that doesn't make every woman in America angry, I don't know what will. But I I wasn't making a lot of money back then, and so he called it my facial fund. But I will tell you, as the business started to grow, and as I started to not only identify my strengths, as you said in the last question, but also started to identify more needs in the community, and that's the big thing, right? Because we all live in different types of communities, and there's many different needs that can be identified. I'm so blessed because I have I'm fortunate enough to be teaching classes all over the country, and I see so many differences in different communities no matter where I go. But I would say a business plan is important. It's really important to have a plan that's going to guide you for your future strategies and any of the financial development and things that you plan to do. But that plan that you come up with has to be dynamic. My practice today is completely different than what I envisioned over a decade ago. Some of the things that I'm doing now, I had no idea I'd be doing. I actually coach individuals who are trying to build successful practices like mine. So not only do I work one-on-one with individuals, but I also, and I teach, many different classes. I teach, for the National Society of Health Coaches, but also programs that I write on my own all over the country. But I have the pleasure of working with people that are trying to build their businesses, and it's so important to have a mentor, somebody that you can bounce ideas off of. Our business, when you are in private practice as a health coach, can be lonely. And,
Yes.
that's one thing I think people might not realize is that you're kind of out there by yourself. And so I found different mentors along my journey. You're one of them, Melinda.
Oh,
People that you can bounce ideas off of when you come up against a challenge or an opportunity. People that you can brainstorm with. So again, making sure that when you're putting your business plan together, don't make it so rigid that you can't branch off into different areas. Because again, my focus early on was weight loss. That was really a big part of the plan. And actually now it's not just weight loss. I mean, weight loss is in there, but I work with digestive issues and heart patients and cancer patients, diabetics, you name it, any health issue I'm working with now, and it's such an honor, and it's very exciting.
what you said about a business plan, I think, is so key because I look at it as I look back on some of those business plans that I've written as well, and you alluded to this, which is the fluidity of it. And I think the reason is for that not only does business change, but it's almost like taking minutes at a meeting. If you don't have those minutes, you don't always remember what has been said, what was decided, what was going to happen as a result, or what the measurement was that you were going to use to evaluate to see, do we want to continue this or not. But that business plan, at least when you're thinking through some things, it's not a bad idea to at least write down some of those things that you've thought of. It's amazing the way things are moving so fast today. What I have found in my practice is that if it's not written down somewhere, I will overlook it going forward. And sometimes I look back thinking, seriously? How could I have forgotten that? But I think it's just a test to the speed with which we're living our lives today.
And even when you write things down, if they don't happen, they'll often open up a door to something else. And so I think that's what people need to pay attention to, is that maybe plan A didn't work out so great, but plan B is going to be a good option.
Because we do have a lot of dead soldiers. Are there certain personality traits that you think are better suited for independent practice, especially, given that you've helped so many in their own independent practice, and I know you've seen all kinds of personalities. Would you say that there are certain traits that are better suited for this line of work? And if yes,
Right.
what would you, would you describe them? What are they?
Well, great question. It's interesting because when I coach people to build their businesses, I don't try to create mini me's, because everybody is unique and brings certain unique strengths and abilities to this type of practice, and we need more health coaches out there. I don't think I can't say that enough, because we need more people like us out there. So I would say probably the most important personality trait, if you would call it this, is to be an empathetic person. And you know, I have to say, in one of the coach clinics that I was teaching for the National Society of Health Coaches, I was in, I think I might have been in Lake Placid, New York. I had a woman come up to me and say, she was a nurse practitioner, and she was in the coach clinic, and she said, "I'm an empath." And I said, "Well, what's an empath?" And she said, "I'm an empathetic person." So if I were to say what's the most important personality trait for somebody, I would like you all to be empaths, please. Somebody who is empathetic, putting themselves in someone else's shoes. And I think, you know, I look back at my own experience when I was diagnosed with cancer in 2003. I would say that back in 2002, prior to my diagnosis, I would have told you, Melinda, oh, I'm a very empathetic person. And I think I thought I was, but I don't think that our society thinks we are as empathetic as we think we are. And
you know,
so,
that's true. And the research actually supports what you said.
yeah, it's pretty amazing. And I know that for me, after my diagnosis, you know, I can, well, first of all, my doctors would tell you I was probably the worst patient ever. Because I was self-diagnosing, silencing my own alarms during chemo. You know, I had quite a few run-ins with some of my doctors because I thought I knew better. But I will say that after that experience, when I sit down with somebody who has a life-threatening illness, I can really feel it. And it's not that I let my emotions get in the way, but it gives me the opportunity to have some insight into what it would be like to be them. And I think that is one of the best gifts that you can give to your patients, your clients. So empathy is very important. I would say another personality trait that's really is being a good listener, and also being resourceful. You know, it's amazing what you can discover when you just shut your mouth. And I mean that respectfully to everyone, but if you sit back and you listen to what people have to say, oftentimes you will uncover more information than if you were drilling them with questions. You know, many times they will share with you even solutions to their own issues because you're just listening. And think about it, you know, how many times have you been able to sit down and have somebody truly listen to what you have to say uninterrupted, you know?
Very true.
And so good listening, I would say, is very important. And I think the last one is to be a little bit fearless in this industry. You know, fear is really normal, but it doesn't have to be debilitating. And I can't tell you how many times I saw an opportunity and I'm like, oh, should I do it? Should I do it? And then I would go for it. And many times it worked out. Sometimes it didn't. But if things didn't work out, I learned something from it. And then I was able to explore other options from there. So those would be the personality traits I think are most important for this type of business.
Yeah, I would absolutely agree with you there. And those things don't always have to be inherent. They can actually be learned. You know, some of those can be practiced, which is good news for those people who feel like they would like to go in independent practice, such as yourself. And see, it's like you say, be fearless and try, because you just don't know until you do try. So looking back, what do you attribute your success to in really sustaining your practice for 12 plus now into 13 years, especially given that you started out way before health coaching became the thing of the day and got in its prime?
Well, I would say the first would be to roll with the changes, Melinda. Roll with the changes in science and technology. If you look at, I'm a whole health educator, which really looks at whole person health care, how everything is connected. One of the things that I do with individuals is I sit down and listen to what their concerns are, but oftentimes, the research and the information and the science that we had back 10 years ago might have changed between now and then, and some people may be holding on to old information and not be able to transition to some of the new information. So for me, I would say rolling with the changes with science and technology, being able to modify my business plan, and as I mentioned before, as I started to grow, I went through many different phases in this business. There were times when I would be really part-time, and then times I would be full-time. And I was able to adjust that. That is the beauty of this type of business. Being adaptable, making your plan better. Listening to your consumers, that's a big one. So what are they saying? So I'm a big advocate of finding your champions, right? So if you've worked with somebody and they're just singing your praises, see if you can get a testimonial out of them. Also word of mouth is something that they can do to share your wonderful message. But listening to what they have to say. So if it's working, keep doing it. But if it's not, tweak it. And those are some of the things that I learned through the National Society of Health Coaching, which is looking at your outcomes, being able to measure your outcomes and saying, okay, this is working, this isn't working, what can we do to tweak that?
Very, very good. And I agree 100%. Outcomes are so important, and being able to know how to look at those things, whatever those things might be, and take a measurement along the way. And it doesn't have to be real formal,
Exactly. Some of the things I did when I'd be doing a workshop, I would ask people for suggestions. And for example, some people were saying, look, we really want to work with you, Jackie, but you're too far away. So I started teaching classes online. I have many medical professionals that attend my workshops, doctors, nurses, chiropractors, and they were saying, hey, can we get any CEUs for these? So now I'm starting to look into ways that I can offer continuing education for medical professionals.
Sure.
I think some of the other keys to being successful for as long as I have been is learning to be very efficient with my time and my energy. It's very easy to get bogged down with some of the information, or say you have somebody. I had a gentleman come into my practice last week, a very complicated case, lots of issues going on. And I found myself spending quite a bit of time researching his situation before I even had a long conversation with him. So really what I needed to do, and that was really, you have to do a little self-reflection in this business, and you sit back and going, I don't need to be spending 3 hours researching this. I need to sit down and listen to this gentleman, hear what his concerns are, even listen to what he may think be contributing to some of his challenges, and then together we can partner and come up with the plan that would work the best for him. So I think just being able to listen and identify challenges, are big things that you can do in your practice. And the other that has helped me sustain this practice for as long as I have is really paying attention to what's going on in my community. How do I hit the largest audience? And some people look at the internet and think, oh, this is so overwhelming, but there's a huge opportunity there, Melinda, for educating large masses of people, which is really what I've kind of moved towards. I still have a weekly Living Well class that I host in New Hampshire, and I teach classes. I get hired by companies and teach them all over, but I'm also here. Like, I can connect with people in California and other parts of the world, and share this message of whole health to individuals that aren't even, driving distance to my home.
Exactly. I think a lot of times we feel like we're a stranger in our own town, or, you are a stranger in your own town, depending on the size of your location. So reaching out beyond just the personal location can be very, very critical for sustaining a business. So yeah, Jackie, I absolutely, see that in our own practice here.
Hmm.
Very, very important, very important to leverage the ability to use social media and the internet. So this is something else too that people struggle with, and that's the marketing piece of this, because sales and marketing can take up a lot of time,
Hmm.
a lot of financial resources if you're not careful. So if you wouldn't mind sharing what those marketing initiatives were that you felt really yielded the best results. And I know that not everyone necessarily, what might work for one person doesn't necessarily work for another, but in your case, what do you think yielded the best results for you?
So social media is really helpful. That's a big one. And so I don't even know if I need to cover that, but I tweet, I twit, I Facebook, I Instagram, I LinkedIn, I do all those things. And really it can be a full-time job, but if you get one really good message, you can post it on all of those different sites. They can be the same message, and you'll hit different audiences as you do that. So again, that social media presence is really important. I think I guess maybe I'm a little old-fashioned. Word of mouth is really important. Your reputation. Like, so my website is JackieBryan.com. It's my name. And so it's very important to me that my practice represents science-based information that people can use and apply to their lives. So for me, word of mouth. If somebody walks around saying that I've done some wonderful things and partnered with them, and that's a great way to market yourself. I really kind of steer people that I work with building their businesses away from spending a lot of money on advertising. You see the big ads in the newspapers. One of the best things you can do is partner with a reporter at your newspaper. I have some wonderful connections with some of the local media, radio station, newspaper, and most of the times I'll send in a press release, and they always put it in their medical Sunday section for me, which is a great place to communicate some of the things that you're doing. But oftentimes I'll get a story out of it. So I'll write the reporter and say, hey, this is my press release, but I'd love it if you were interested in doing a piece on it. And there's several, many, many times I've gotten a full spread front page story on the Sunday medical section for a new program I'm doing. So that was always a great way to kind of get messages out there. I have an email distribution list, so whenever I do a presentation somewhere, wherever part of the country I'm in, I pass out evaluations, and I ask people if they'd be interested in being on my email distribution list. And once that email distribution list grew past 500, I hired I hired an organization called Constant Contact to help me with managing the emails. And actually, so I do now a monthly newsletter with some fun little recipes on it. I let people know about what upcoming programs I have. So it's a nice way to engage people. I think it's super important for people to understand that if you're out of sight, you're out of mind. So
True.
the social media helps you maintain a presence in people's lives, and in a non-irritating way. You don't want to be irritating people, but you want to find a way to connect with them. And sometimes it's just sharing a new study that's out, even interpreting. Like I remember back when the Biggest Loser study came out a few years ago, and people were in a panic. I must have received like 60 emails from people asking me about the study. So I did a little research on it, then I posted some information on it, and for those people in this industry, you become that credible resource for the individuals out in the community that they go to. You're the go-to person for health information, and it's a real honor and privilege to be that person. But with that role comes great responsibility, and so I always feel it's important to educate myself. The other piece with marketing initiatives, especially when you're starting out, is donating to some cause, maybe one of your services. So as a breast cancer survivor, I co-chaired the Susan G. Komen Race for the Cure in the state of New Hampshire for several years, and then I donated for their auction items. But I'll donate to several breast cancer organizations. I've donated to Open Heart, Mended Hearts, and I'll work with disabled groups. I'll donate my services, and it's not that I want people giving away their services for free, but it is truly with great heart that I give these services away. It's not just because I'm marketing myself, because if you're just doing it to get your name out there, that's not the right way to do it. But if you're truly passionate about certain causes and you get yourself out in the community, people learn about some of the things that you do. And then when you get those champions, ask them to write just a couple sentences about how they feel about you and the service you provided. Put them on your website, and those are great ways to market yourself.
Absolutely. And it's so true. In the beginning, I loved what you said about leveraging your local newspaper, especially if you have a local practice, and those of you who may begin your local practice, is that writers are looking all the time, looking for local type of articles and featuring people in their community. So not only is it a helpful thing for the community and people who are looking for that, but it's helpful for you. And like you're saying, establish yourself as someone that can be trusted with medical information and to share the right medical information, because there is so much out there in the way of information now that people can access it online and get more information than they ever wanted. Also, it's a time saver. Trusting and time saver to be able to go to someone like yourself is just invaluable. So I appreciate the fact and respect you so much for what you've done for many reasons, but especially for
well, one other thought on this, Melinda, about marketing yourself is, remember I shared early on that this can be kind of a lonely business.
Yes.
See if you can connect with like-minded individuals. So if you have a massage therapist that you love, or a personal trainer, or a physician, if you can connect with them, they'll refer people to you, you'll refer people back to them, and it becomes a win-win. So it's a great way to get your name out there, and it adds some credibility to your practice. And that's one thing that I've done, is really enmesh myself in the medical community. In our area, we've got 3 or 4 local hospitals here that I have relationships with, and all of them, but also, even an esthetician or a hairstylist, somebody that you really like, just they'll be willing to put your flyers out for you. So anybody that puts my flyers out for me, I offer them a free ticket to one of my workshops. I'm like, hey, they're doing me something, a nice favor, so I'm like, okay, come and enjoy. I'd love to have you. So it's a nice win-win for you and for them.
Sure, and they appreciate that so much, as you do. So wonderful. And moving from what I call the fun aspect of running a business, which is the marketing aspect, is moving now into something a little bit more serious, but all of it is serious, is what kind of red flags should people be keeping their minds to be cautious of when they really begin an independent practice, especially in coaching? Are there red flags?
There's a ton of red flags. Well, I will share. I learned them the hard way. But I would say, first of all, our job as health coaches is not to be people pleasers, but to help people access those inner resources that they need to make their change, the behavior changes that they need to make. So often we think we have to yes them, oh yes, yes, and agree with our clients or patients, but we're actually doing them a disservice when we do that. Our job is to engage them, partner with them, to help them uncover some of the solutions that they may already know inside, but they haven't been able to access. We as the health coach, we don't necessarily have to have all of the answers. And I think that takes a little bit of pressure off of us, because if we feel like we need to have all the answers, we get anxious and we may not be able to be fully present for the person when we're working with them. But when we sit and listen to them and just be present for them, then oftentimes that's enough. Listening and engaging that person. So I'd say a red flag would be not to be a people pleaser. Another big barrier I've seen, and this really comes from the experience of coaching other people as they're building their businesses, and boy, do I get the funniest emails from people. You're not going to believe what happened, Jackie. And I love it. I love it because, I'm always a student, Melinda. I am always a student. So when somebody calls or emails and tells me something that's happened, I say, ooh, okay, I'm going to be on the lookout for that. But exactly. Another big barrier for the coaches is really understanding what your value is and what your worth is. Oftentimes we undercharge. I know that when I first started out, I was charging way too little. I was incredibly busy, and I had a friend of mine who was in a kind of a similar industry. She was actually a professor at a school that for nutrition, and she said to me, she said, "Look, you're undercharging," and I was overworked, and so I upped my pricing a little bit more, and I think people took me a little bit more serious. So trying not to give your services away for free, recognizing that what you have, there's a value to it, and people will pay for it. And as long as you're reasonably priced, it's I think a very fair part of your practice. And it's also, people need to have a little skin in the game in order to be successful. Oftentimes they don't mind paying a certain amount of money because they know that they're invested in this process just like you are. Another red flag would be the fact that you really need to be patient when you're starting to build your business. It can be really frustrating and truthfully a little scary, especially if you're the sole financial provider in the family. Fortunately for me, it was just my facial fund early on. However, it is no longer the facial fund. It is a very wonderful contribution that I'm able to offer my family. So I think it's important to note that it can be scary, and you have to be patient as you build your business. Some people that I coach have 2 jobs. I worked with somebody that has a fitness studio and they're building their practice, or they're working as a nurse and they're building their practice. It's hard to just leave everything behind and just go make this your sole practice early on. I think the self-evaluation that we need to do when we get into this practice is to recognize that not everybody is cut out to be a one-on-one health coach. Not everyone is cut out to be a professional speaker. I was trained professionally as a speaker, so that was something I was really passionate about and really love, but it's not something that everybody's comfortable doing, so it's important to find your own niche. And then I think the other red flag, and I think this is super important now, because we talked about if you ever Google health coaching and you come up with all these hits, it's really important for the health coach to be able to explain why they are the better choice. Because people that sell supplements, people that have no health background whatsoever can say, hey, I'm a health coach. It can be a pretty saturated market, and it can be incredibly confusing for the consumer. So being able to differentiate yourself from another health coach is important, and I do it all the time. I am a health coach. I'm a whole health educator. I call myself the dot connector, Melinda. I talk about how we have these specialties today in medicine. We have the oncologist, the urologist, the pulmonologist, the cardiologist. We've got somebody that is really responsible for each organ, but nobody's connecting the dots. Nobody's putting all the pieces together. So I call myself the dot connector.
And especially navigating the system, navigating the health system in general is definitely something a dot connector, is needed for far and away.
Doesn't sound real fancy, but it works for me. My dot connector. That's my
Absolutely. Well, what are and you've touched upon this, but crystallizing it just a little more, what are your professional goals and your personal goals going forward from, where you have come the very, very beginning to now where your practice is flourishing? What do you see in the future for yourself?
That's a great question, and truthfully, it changes every day. Depending upon my mood, no. I would say my number one goal personally and professionally is to make sure that I have a profession that's a good fit for my family life. I have a wonderful husband, three amazing children, and they're the priority. You know, they're the most important thing to me, my family, and making sure that whatever I do in my life is a good fit for the family life. And I will tell you early on, and even now, I am so incredibly excited about what I do every day. It doesn't feel like work. I could work all the time. And so it's important personally and professionally for me to make sure that I manage my time and that I am respectful and present for all of those people in my life. I would say that the other thing that is incredibly important to me is to continue to engage my clients to facilitate health behavior change. And in order for me to continue to engage them, I need to continue to educate myself. This is not a stagnant profession. This is not a profession that you can say, okay, I'm done. I'm just going to sit here and run my practice.
Exactly.
Every single day, I have my nose in a book or in a newspaper or online and reading and, you know, ingesting and soaking up all of this new information, and then I cross-reference it and make sure that it's, you know, legitimate on PubMed or Science News. I look to make sure that it's a credible resource. And then once I get that information, you know, these new studies, and if something is really compelling enough, I might build a new program around it. I mean, for example, I just wrote a program on microbiome. Because this is really, you know, they're calling it the newest human organ, the microbiome that is in your intestinal tract. And so I wrote this, oh, it is such, I wish you got to come see it, Melinda. It's so fun and engaging, and it's called Chew on This.
Wow.
And
I love it.
it's a good one. But my goal is to continue to build a practice that explores the cutting edge research and I love taking complicated information, you know, breaking it down for my clients into easy to understand information and strategies that they can adapt into their current lives. You know, practical, useful information, because there's so much stuff out there, but people don't know what to do with it, and that's our job as the health coach. So that's what I want to do, and that's one of my plans. You know, is acting like that translator for the medical language. You know, that people can really understand. And so I think at this point in my career, I want to continue to teach these classes all over the country. I want to continue to broaden my reach. And I'm so fortunate that, you know, every week I'm getting a new opportunity, and it's just been such a blast.
That's amazing. I mean, you are just so special, and we've appreciated so much everything that you continue to do on our behalf in terms of the National Society of Health Coaches. But I have one another question that's more on the legal side too, is, and we have this question asked a lot of times, more than I would have ever expected actually. What type of professional insurance have you found to be most effective for those in independent practice?
So for me, you know, I've always had insurance, and some people, you know, they'll just go off of their nursing insurance, you know, through a hospital or whatever. But for me, I really wanted that added protection. So initially, when I started out, I had insurance just as an individual, and I got that insurance through the Nurses Services Organization, NSO. And then when I formed my company, my LLC, I recognized that I needed to have insurance that would not only represent me, but also my company, which was a little more costly, but it did provide me with the added protection that made me feel comfortable. And so in my situation, because what I do is fairly unique for a registered nurse, I had them put an amendment in the insurance policy for consulting and for health education, and that covered me for almost everything that I'm doing, or everything that I'm doing now. I also have a NPI number, a National Provider ID number, as a health educator, which means I can accept health savings accounts, flexible spending accounts. I don't actually bill insurance. I act as more of a secondary provider, but it's a nice option for people that really want to use those flexible spending account dollars on things that can facilitate behavior change and keep them healthier.
Sure.
So I use the Nurses Services Organization as as an insurance company. I've been very happy with them. But if people call and tell them what they're interested in doing, they can guide them. They have reps that can then guide them and help them understand what would be the best policy for their practice.
Well, in addition to that, have you found state regulations to limit your practice in and out of state? I know some states vary in terms of what they allow, varying credentials, nurses to do, physical therapists, and so forth,
Right.
as well as physicians. So what have you found in that regard?
So, I live in the state of New Hampshire, and our state motto is "Live free or die." So that might give you a little indication as to the amount of guidance or restrictions and things like that I receive. Back in the early 2000s, when I contacted the New Hampshire State Board of Nursing, I explained to them what I was doing, and I was told at that time that the board covered me under my scope of practice, fell under community education. So that worked out fine for me. I don't prescribe medications. I use techniques that facilitate behavior change. But was really fascinating when I called them, Melinda, over 12 years ago, the registered nurse that I spoke with at the board was really excited about what I was doing, and she wanted me to explain, more about what I was doing and how I saw this business moving forward. And then she asked me to call her and keep her up to date as to what I was doing. So it was really exciting to see that there's nurses that are out there that are thinking, wow, this is an opportunity, but maybe they're not really sure how it all works. So I as far as state regulations, it fell under community education, and again, I had the added protection of my Nurses Services Organization, but I really do encourage people to continue to educate themselves, get certifications that they think may be applicable to their practice, which is what I've done. I've received some nutrition certifications and things like that offer me a little bit more flexibility in my scope of practice as well.
I love that, live free or die. I was going to say, yeah, probably she was probably just taken back by even wanting to. Well, then really there weren't that many nurses in independent practice of any kind, and I realize that hasn't been that long ago. But still, I think it's wonderful, and some of the reasons why those of us at the National Society of Health Coaches have moved out too into sharing what we know with others. So we certainly admire you beyond what you can ever imagine for really kind of being in the same kind of mindset that we have been in here, which is, use your abilities and maximize on those talents, because there's people out there who would love to do some of the same kinds of things but may not know exactly how to start and how to get going. I do, in closing, what final thoughts would you like to leave with the listeners today that maybe you haven't touched upon, or a question that I haven't asked that you feel like would be very, very helpful to them?
I would say to be yourself and recognize that you have unique strengths that would be incredibly helpful for many individuals out there. Be creative. You don't have to follow along the same path that everybody else has, but you can come up with your own types of programs and strategies that might be helpful for another individual. I think if you continue to have compassion and empathy and energy and excitement for this field of health coaching, and really a passion for helping people improve their quality of lives, you'll be successful. And it's such an honor to be here, Melinda, with you. I truly appreciate it.
Well, we thank you so much for being with us today, and Jackie, it's been so insightful. Thank you for sharing your experience. Nothing can speak more like the experience of someone who has been there and why they moved into that direction. It certainly wasn't a whim. It was more about what had happened in your life that has been a passion and has developed a compassion for others in similar circumstances, and how that just kind of propelled you to move forward. And you will continue to be blessed in every way, as you have shared with me personally, and I know professionally you have shared that with others. And I would like for our listeners to know that to contact Jackie for consultation, please feel free to do that. Her contact information is here before you, as well as those of you who might, as she mentioned earlier, she began to get her foundation for education and training in this particular mode of assisting others through the National Society, that you can contact us as well to ask about training, education, or certification. Please feel free to share this information with others, that we hope that you'll know that you certainly can, and we'd like to help you in any other way. And Jackie, again, thank you from the bottom of my heart for being available to really share all of your experiences that you've had related to your independent practice and beginning that practice, and what your goals are for moving forward. We appreciate you so much, and thank you again.
Thank you so much, Melinda, and thank you to you and Colleen Miller for creating such an amazing program that is going to improve not only the health of our communities and our patients, but also create a much better experience and feeling for those medical providers that partner with their patients and guide them towards change. So thank you so much for all you do. It was an honor to be here, and it's great to talk to you.
Oh, it's great to talk to you, Jackie. And we'll talk to you again real soon. Thank you again so very much.
Thank you.
Bye-bye.